Hi everyone. Today I'll be talking about the water-soluble vitamin folate. And there are several forms of folate. It does become a little bit confusing, so let's review that now. Folic acid is a synthetic form, meaning when you go and buy a supplement, that's what you'll be getting. Folacin or folate naturally occurs in food, so they're different. The folic acid is also found, again, the synthetic form is also found in fortified foods, as well as the supplements I just mentioned. The folacin and folate terms are one and the same, and that's the reduced form that, again, naturally occurs in foods and is found in the tissues in your body. Food sources of folate I've listed for you. I think orange juice is one of the most commonly known, or the food that actually pops into mind when I think about folic acid. And I've listed the others for you as well. There's a number of sources. Obviously, it's not an inclusive list. It is found in higher concentrations in raw foods than cooked foods, so keep that in mind. Heat, oxidation, and UV light will destroy folate. Fortification began in 1998, and now most people ingest or take in enough folate. It's rare to see a deficiency. It's very uncommon. The bioavailability from the various foods does vary, however. The recommended dietary allowance I've listed for you. We'll talk about dietary folate equivalents, DFEs, per day. Notice that it's a very small amount that's needed. It's a microgram amount. And in pregnancy, the RDA is 600. Most OBs will recommend at least 800 micrograms of folic acid for their patients. Let's talk about digestion, absorption, transport, and storage. The polyglutamate form, which is found in foods, first has to be hydrolyzed to the monoglutamate form. So when you purchase your supplement of folic acid, it's in the monoglutamate form. Same as with the folate in the fortified foods, it's already in the monoglutamate form. It's reduced to tetrahydrofolate in the enterocytes. So in the small intestinal cells, it's actually reduced. And the transport mechanism is through portal circulation as 5-methyl tetrahydrofolate, and there's a protein-coupled folate transporter, PCFT. The primary form found in the blood is monoglutamate, and it's excreted in both the urine and the feces. So what is the purpose or function of folate? Well, it does play a role in amino acid and choline metabolism. It plays a role in gene expression, and it also plays a role in purine and pyridamine synthesis and nucleotide metabolism. So it has a role or influences DNA synthesis as well. I mentioned the dietary folate equivalents, or DFEs, and these were developed to illustrate or reflect that the folic acid found in supplements has a higher bioavailability than that which you would actually get in food. So 1 DFE is equal to what I've listed below, 1 microgram of food folate, or 0.6 micrograms of folic acid from a supplement or something that's been fortified, and 0.5 micrograms of folic acid from a supplement taken on an empty stomach. And there's also a formula that you can use to calculate the DFE. In terms of deficiency and toxicity, well, it does affect cells that rapidly divide. So red blood cells. Mature red blood cells, of course, don't have a nucleus, and they turn over about every 4 months. That's the reason we do a hemoglobin A1C when we look at blood sugars for diabetics. Glycosylated hemoglobin, those red blood cells are turning over every 4 months. Without the folate present, the precursor cells for the erythrocytes, or the red blood cells, enlarge and they can't divide. So again, folate plays a role in that DNA division, DNA needed for division, and you get these large or macrocytic looking cells. And then the bone marrow is actually releasing these immature abnormal cells, these erythrocytes, and they're called megaloblasts, into the bloodstream. And that leads to megaloblastic or macrocytic anemia. In terms of toxicity of folic acid, the upper limit is 1 milligram of synthetic folic acid, so the non-natural, that which you would purchase. We know with deficiencies, we see neural tube defects. During the first few weeks of conception, the neural tube forms, so it's so very critical that women of childbearing age take in adequate folate to prevent this. And there's been a campaign, the March of Dimes has had a campaign to educate people about this. The neural tube develops into the brain and spinal cord, of course, and if you are folate deficient, you are at risk for giving birth to an infant with these defects. Some people who take medication for seizures, it competes or interferes with the folic acid, and this is a real potential problem for neural tube defects in women that have to take medication for seizures. There's two common types of neural tube defects: spina bifida, where the vertebral bones don't form properly, and then you have the actual spinal cord exposed or not enclosed or encased as it should be. And then encephalopathy, where the brain is actually missing, part of the brain does not form. So tragic cases which more often than not can be avoided. In terms of how we assessed folate status, usually it's a plasma or serum level. There are some other means of assessing folic acid, but we don't use them in a clinical setting, perhaps in a research setting or an academic setting. They may be looked at or assessed. In the past, 5-10 years ago, there was kind of a trend to look at plasma homocysteine levels. That's kind of gone by the wayside right now. In my career thus far, and it just happened, I've only seen one individual with a folate deficiency. It's literally unheard of. And this particular individual was an alcoholic, and you need to have several months of essentially absent folate intake from the diet to become deficient. So I thought that was very interesting that this particular individual presented with a folate deficiency. Again, have not seen that. Please let me know if you have any questions.